This is Dr. Someshwar from Shield Healthcare. I hope everyone doing good. And I welcome you all on to the Menopause series by Dr. Payal Bhargava, a co-founder of Divine Magic Foundation. Before starting the talk, let me take privilege to introduce Dr. Payal Bhargava ma'am, who is a postgraduate diploma in ART from and reproductive medicine from Kiel, Germany. And she did her fellowship in infertility from IMA Hyderabad, and she is a life member of IMA Menopause Society India and PCOS Society India. She is a member of Managing Committee of PCOS Society India and co-founder and director on board XPS Analytics Private Limited, and consultant at Sri Krishna Diagnostic Center and also consultant at Pranada Hospital, Hyderabad. And she is a co-founder for Divine Magic Foundation, a public health and awareness initiative working at grassroots level and digitally through its YouTube channel. Now, without much further ado, let me turn over the time to Dr. Payal Bhargava to take over the session.
Welcome all to our 7th series of Sailing Through Menopause. In the previous episode, I talked about how to prevent osteoporosis and build bone health. Today, I'll be discussing on another very important topic, diabetes in menopause, which is rampant in our country, and we need to be aware about the causes and symptoms of diabetes and how to manage it in elderly. Welcome. Diabetes is a chronic metabolic disease characterized by elevated levels of blood glucose. High blood glucose level can damage the tiny blood vessels in kidney, heart, eye, or nervous system. Hence, it causes heart disease, stroke, kidney disease, blindness, and nerve damage. So we can see how diabetes affects almost all organs of our body, and it needs to be controlled well. Normal blood glucose level in our body is supposed to be 70 to 100 milligrams when fasting and can go up to 140 milligram per deciliter 2 hours after eating. What happens in diabetes is the fasting level is between 100 to 125 milligram per deciliter if you are pre-diabetic, and more than 140 milligram per deciliter when fasting, and it almost crosses beyond 200 level 2 hours after eating. So how does a person feels when he or she is diabetic? There will be tingling in hands and feet. There will be weight loss. Blurring of vision can be there. There will be frequent urination. You will feel dizzy, tired, and have mild headaches, hunger, and thirst. So if your diabetes or your sugar levels are uncontrolled, it will damage your brain, leading to cerebrovascular disease. It will damage your teeth, leading to tooth decay and cavities. It will damage your nerves. You will have eye problems, coronary heart disease, and kidneys are also affected. The risk factors associated with type 2 diabetes are: if you have a family history of diabetes, you are very likely to develop diabetes later in your life. If you are overweight, if you have an inactive lifestyle, if you have very high levels of blood pressure, if you have elevated cholesterol levels, if in your pregnancy you develop diabetes, if you are older age, more than 40 years and beyond, if you have impaired glucose tolerance or impaired fasting glucose levels. Now here I would like to point out there are 3 types of diabetes. One is type 1 diabetes, which occurs in younger people. Then we have type 2 diabetes, which develops later in the age. We have gestational diabetes, which occurs in pregnant mothers. And the fourth one we can consider now is pre-diabetic. That is a stage before diabetes where your blood glucose level are slightly high but not very high to be considered a diabetic. So why are we discussing this topic today? Let's see what is the correlation between diabetes and menopause. When diabetes and menopause occur together, they give way to increased medical issues. There is excess weight gain. Now, we have already seen in our previous videos of menopause where menopause leads to central obesity. That is, there's weight gain in your mid area. This weight gain makes you prone to diabetes also. Then there are sleep disorders which occurs in menopause due to decreased level of estrogen, leading to hot flushes and other problems. All these improper sleep pattern leads to increased levels of blood sugar in your body. Fluctuations in blood sugar take place in menopause due to imbalance of hormones. There will be sexual dysfunction. Now, as we already know, in menopause, there is dryness of vagina. Now, superimposed diabetes leads to nerve damage in the vaginal area, which makes intercourse very painful and difficult. There will be frequent infections due to increased level of blood sugar during menopause. You will have urinary tract infections, that is, you will have, and other metabolic disorders also associated with increased infections. There will be difficulty in wound healing. The other major problem which occurs in menopause and diabetes is heart problem, that is heart attacks. So diabetes is India's bitter truth. More than 50% of subjects are undiagnosed in our country. The number of diabetics estimated in 2015 was 69 million, which is supposed to be 125 million around 2040. So diabetes is a biggest worry in our country. So what can we do to prevent and manage diabetics in our country? The first step is screening. Opportunistic screening for all women above the age of 30 years annually for younger women with risk factors should be done. Diabetic women should be screened for hypertension, dyslipidemia, microalbuminuria, and undergo yearly eye checkup, as we have seen how diabetes affects all the major organs of our body. The goal in management is to maintain the HbA1c level around less than 7% and control risk factors for cardiovascular disease, which is a major cause of death in both diabetes and menopause. So which are the women we need to screen? Now, we have already discussed which are the patients which are at high risk of developing diabetes. The ones which are physically inactive. If your parents are diabetic, it is better you get yourself tested early and keep yourself screening for diabetes. Mothers of big baby, that is, if you have developed diabetes during pregnancy, you are more likely to develop it later. Then if you are hypertensive and your blood pressure is usually more than 140/90, if you have increased cholesterol and triglycerides, if you have PCOS, patients who are on steroids or antipsychotic drugs or antiretroviral therapy are more prone for diabetes. Now, the screening test which we usually do for diabetes are fasting blood sugar level, then postprandial blood sugar level, and HbA1c, which gives a value of 3 months of your sugar levels in your body. So how do we manage diabetes? Diabetes has been called a lifestyle disorder, which requires not just medicines, but a modification of one's lifestyle, such as diet, exercise, and monitoring. Diet and exercise can be offered to all women, both as primary prevention and as a part of established diabetes. So what are the practical aspects which we should consider in elderly women? The aim of drug treatment is to reduce symptoms, prevent or postpone the onset of chronic complications, improve the quality of life with the least possible adverse reactions, reduce the risk of cardiovascular events, which is very common both in diabetes as well as in menopausal women. Now, in individuals with established coronary artery disease, that is, they already have health problem or long-standing diabetes, or those which are at high risk, like who have other metabolic syndrome disorder, or they have high levels of glycerides in their body, we must check HbA1c and maintain it below the level of 7 all the times to prevent the adverse effects of diabetes. The elderly may have practical difficulties in administrating themselves with insulin, which may lead to hypoglycemia at times. Now, for diabetes, we give patients both oral medications and insulin. But what we have to be careful about them is that you have to take these tablets or insulin with proper diet. Sometimes if you don't take your food at regular times and you take a dose of insulin, it may lead to hypoglycemia. That is, your blood sugar level will suddenly go down, you will feel giddy, and you might fall also. So in elderly people, we have to be very careful about these things. Now, diabetes, besides affecting all the major organs of our body, it affects differently the elderly. They feel defeated. There is denial in some patients of a symptoms that they have developed diabetes. Loneliness, it leads to less motivation, frustration, and sometimes fear also. So with a trend towards living in nuclear families, and particularly women often lack the social and emotional support of an extended family, effort must be made to consider these aspects and provide assistance where possible in planning management of diabetes. So as we have seen, diabetes is a very debilitating condition. Let's see what we can do to prevent diabetes in all. Primary prevention of diabetes is more cost-effective than interventions later in the course of the disease. Preventive measures could begin even before conception. When pregnant women are provided adequate and appropriate nutrition so that their babies are not born small, low birth weight, is a risk for later onset of insulin resistance, diabetes, and cardiovascular disease. So as we can see, it is not just when you develop diabetes or in a pre-diabetic stage that you need to prevent or manage diabetes. It has to be started very, very early. Now, the lifestyle measures have been shown to be effective in primary prevention of diabetes. Both physical exercise and a modest loss of weight in subjects at risk reduce the onset of diabetes by nearly a half. Physical exercise has collateral benefits as well. It strengthens muscles during menopause. It prevents excess bone loss, that is, prevents osteoporosis and improves cognition, all of which are critical in the perimenopausal and both menopausal women. So activities of daily living also contribute to physical exercise, such as moving around the home, performing daily household work, and reducing the time of sitting still. Formal outdoor exercise can consist of walking if facilities for more formal exercises are not available. One should, however, bear in mind that physical safety must be ensured to prevent falls, traffic accidents, and being phoned by strangers while going for a walk. In the elderly, proper footwear and care of the feet are needed to prevent injury. As we have seen, diabetes leads to nerve damage. So proper footwear is very important in diabetic patients. Similarly, physical aids such as banisters are required to offer support while one moves about in the house. These are better than managing the effects of fall and fractures which are discussed in my previous video of prevention of fall in elderly. So what are the practical aspects in implementation? Women who are not used to exercise should start gradually and step up physical activity over time. They may initially walk and then graduate to brisk walking. This does not need equipment or training and is possible with little cost involvement. As a general rule, a total of 60 minutes of physical activity is recommended every day. This includes aerobic activity, work-related activity, and muscle strengthening activity. All these are discussed in details in Exercise During Menopause. Physical activity need not be done all at one go. It can be accumulated throughout the day in blocks as short as 10 minutes. So what I mean to say by this practical aspects in implementation is that some kind of work is a must in menopausal age. Whatever you do, you should not sit for a long time or lie down for a long time. So work-related activity should be encouraged wherever possible. So the take-home message of today's presentation is there's plenty you can do to better manage diabetes and menopause. Make healthy lifestyle choices, measure your blood sugar levels frequently, ask your doctor about adjusting your diabetes medications, ask your doctor about cholesterol lowering medications, and seek help for menopausal symptoms. Thank you so much for your patient hearing. Our next topic will be thyroid in menopause, another important endocrine and metabolic disorder rampant in our country. Thank you so much.